Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your hosts Edward McQueen and April Garner.
Okay, it said it's live, time for broadcast. But we still got dealing with this virus. All right, we gotta pause and get to some real stuff now. I know we're live. Good evening. I'm your host, Ed McQueen. This is the World Community Magazine, Hour right here on Facebook, YouTube, and live. Do we hear that? Okay. Co-host, my sister April Garner. The value. I'm gonna assign a value.
You said you're gonna assign me a value.
A value, yeah, right.
Hopefully, it's priceless.
Okay, all right. Took the words out of my mouth. Okay.
Thank you.
Oh boy, how's everybody doing? Look, we for our viewers today, we're going to continue with a serious topic, and that is how we're going to how this virus is impacting our everyday well-being. I'm going to put it in layman terms. You know, we have social impact, economic impact, and mental impact, and all that good stuff. And if we're on the screen today, April, we're going to get right into it with our guest. Dr. Winston McIver, Jr.
Mm-hmm. A walk-in primary care, yes. Yes.
And the Honorable Larry White, Conway City Councilman. Mm-hmm. And we're going to talk about, again, the impact of this virus and what has been happening so far, and maybe a few other questions. And we invite our guests our viewers to really just send some comments in on questions that we want to ask these two individuals. So let's get to it. April, I won't talk anymore. I'll let you carry on.
Well, no, you have to talk at some point. You got to join in the discussion. But what I'm going to do is just remind our viewers, if you have any comments or questions for our special guests, or you just want to, comment on the discussion and kind of join in that way, please post them in the thread on either Facebook, YouTube, and we will get to the comments. We typically try to show as many comments as possible and make the questions as relevant as possible. So we do appreciate all of you being here today. Brother Edward, are you sharing phone lines today?
Yes. Okay. They can call me in if they have something verbal that they think is, and they have some issues with talking to us by way of comments, then absolutely. You can put my phone number on there, and they can call me. I can put them on.
Give me your number. You don't know it by heart. You're on speed dial.
I'm on speed dial.
Yeah, you're on speed dial. We don't memorize numbers anymore. We just press buttons.
That's right. Absolutely. Absolutely.
Yeah.
Okay. 202-460-1390.
Awesome. All right.
Okay.
Yes. All right. So thank you all for joining us once again. And I just want to give some special shout outs. I see we have a few guests in who are viewing, and those of you who are not already active in the thread, thank you for joining us. Thank you, Audrey Jones and Marvin Washington from New York. Thank you, Marvin, my classmate as well. We appreciate you. Yeah, he's a homeboy. So he's trying to stay connected to Horry County, and that's awesome. Tanya Jones, Tanya is a loyal viewer and listener, so thank you so much, Tanya. Bonnie Edie, thank you for joining us today. We really do appreciate it. And of course, again, if you have any comments or questions, please let us know. So today, of course, we have Dr. Winston D. McIver Jr., who is the primary physician and owner of Waccamaw Primary Care, and Councilman Larry White, and they're here to discuss a couple of things. Dr. Mack is going to give us his medical minute, and as a part of the medical minute, we're going to go over what the Delta variant is, because I think a lot of people have questions still about what the Delta variant is all about and how it either is similar or different from COVID, or how it relates to COVID. But also, Dr. Mack is going to share with us hopefully some statistics on the spread of the variant and the populations that are most affected, or at least talk about it from the standpoint of his medical knowledge, the risks to the vaccinated and the unvaccinated, and any other information that we need to know. There's been a lot of talk in across social media, in communities everywhere, about what's going on, especially since everyone has returned to school. And, what we've seen even in the past 24, 48 hours is that a lot of people are, they're not really pleased with how everything's being handled. And a lot of it is because, either folks are uninformed, misinformed, or they're just making choices that aren't in the best interest of public health and safety. So what we want to do is just shed some light on what this variant is all about and why it is important for us to remain vigilant so that you can make an educated decision about what you need to do. And then also, Councilman Larry White is going to share with us today some of the City of Conway protocols, but also recently there was an article that was published about mask ordinances in City of Conway. And look, Brother Larry was only noted as having voted against the mask ordinance. So we have him here today to add some clarity to what happened in that particular situation. So we're going to start with Dr. Mack with his medical minute, and then we'll get into the woods with Councilman Larry White. So Dr. Mack, it's good to see you today.
Good to see you too, April. I really do miss you.
I miss you too. April
and I kind of had some fire going on in 2020 with COVID, and we talked about a lot of different things then, and we're back talking about it now. So certainly it's hard to tell April Gardner no whenever she calls and asks. So
same here.
Well, it's good to see you all.
Good to see you.
The Delta variant. Okay, just kind of going back a little bit about viruses in general. The reason why we can put a man on the moon but can't cure the common cold is because viruses are always trying to find a way to survive and thrive. And they do so by changing their makeup, their structural makeup, ever so slightly to make them able to live and continue to do what it does. So what happens is that when viruses happen, you expect changes in the virus to happen at some point in time. Hence the reason why we have to take different flu vaccines every year, is because the virus does change ever so much every year. What happens is about every year a virus will make a minor change called a drift, and every 3 to 5 years they'll make more of a major change called a shift. And then every 10 to 20 years, they make even greater changes in structural makeup. As it relates to COVID, the initial variant that was out, or initial strain that was out, is different from the predominant strain right now. We did expect in medicine for the strain to change. The problem is that we didn't really expect the changes this fast. Right now, the Delta variant appears to be a much worse, a much more aggressive, and an easier spreadable variation of the COVID vaccine, of the COVID virus. Just as an example of how we measure that, in biostatistics, there's a term that we call R0, letter R0. And basically what that means is when a person's infected, how many other people does that infected person expect to infect? In other words, if I have it, how many people does statistically would be likely for me to infect? The initial strain of the R0, when we first started talking about COVID back in 2020, was an R0 of 2, meaning if I was positive, statistically, I would be expected to infect 2 other people. Well, the R0 for the Delta strain is 8. So if I'm infected with Delta, because of the aggressiveness and the transmissibility of Delta, of the Delta strain, I would be expected to infect 8 people. And that's why this is easier spread, because the virus has made changes ever so slightly to make it more aggressive. That's huge, because if you're talking about 4 times more likely to spread, you're talking about a lot more people that's going to get infected. So that's why the push was so much for people to get vaccinated, so that this could vaccinate and wear a mask and social distance. So that way you'd be less likely to spread this variant. Now, what's happening is that I saw somebody ask a question about Lambda, and there has actually been reports of Lambda being found in Miami. Lambda is kind of in South America right now. That's where you can have it down there, and there have been strains of the Lambda variant, which has not really been getting much publicity because Delta is kind of taken off, but Lambda is out there as well. How aggressive it is, we don't know, but it's running crazy in South America. So right now, that's something that we're talking about. And as more time goes on, more metropolitan areas, bigger cities, New York, Houston, Chicago, Los Angeles, these places will start popping up with Lambda variants as well. We won't know the R naught or the transmissibility of Delta of Lambda until more cases are seen.
Dr. Mack, is it safe to say that we're probably seeing cases in these larger cities because of travel and the fact that these are cities that have a higher population of people who are, even traveling internationally? Why do you think it's showing up there?
Travel, definitely, but also, you have more populated areas. So you have people living on top of people. In these bigger areas, you have more people that are using mass public transportation. So you're having more spread and more transmissibility that way. Mm-hmm. That was the issues that we were seeing in New York City with the subways back in early 2020, Chicago, Detroit, in places that rely on a lot of urban planning and mass transit. Those places, and you started seeing a lot of the transportation workers, bus drivers, subway drivers that were coming down with COVID and unfortunately dying. Mm-hmm.
Yeah. So can you explain? And you may have already said it, but you talk in medical terms. Can you explain whether or not there is a difference between COVID-19 and Delta variant? Is Delta variant like an offshoot of COVID-19?
It's a subtype of COVID-19.
Subtype, okay.
Mm-hmm. Does the fact that it is a sub, then it can't be equated to the same strength, though? Is that correct? If it's a sub?
Well, no, sub just means it's one classification. So you have a fruit, and you have apples of fruit, pears of fruit, or grapes of fruit. It's just a strain of COVID-19. Okay. It's a variation of it. Mm-hmm.
Almost like COVID is the tree and Delta is a branch.
Exactly. That's one way to look at it.
Okay, all right. And of course, what we're hearing, Larry, you like that? But of course, what we're hearing is that Delta is more contagious. Why is it more contagious?
Well, it's more contagious because the makeup of the virus, it has different spike proteins on it, which makes it easily transmissible, easily to hook on the cells and get into the cells. These viruses are smart. What they do is they try to find ways to adapt. And as long as the virus is around, as long as it's around, it's going to try to find a way to survive. Mm-hmm. And that's what viruses do. I mean, like I said earlier, we can put a man on the moon, but we can't find a cure for the common cold. Mm-hmm.
Mm-hmm. Previously they said that
the makeup of the viruses.
Okay. Now the difference in the seasons, have they changed on that, on the impact, the strength of the impact there?
I don't think so, because When it first came out, it was basically wintertime in the United States,
Right.
and it was summer in Australia, and it was rocking through Australia.
Okay.
Mm-hmm.
So we can't expect anything different coming on October, November, December to, try to predict the strength
it probably will get worse. It probably will get worse.
Mm-hmm.
Yeah.
And I remember you talking about that whenever we covered COVID-19 last year,
Mm-hmm.
that, once we got into cold and flu season, there was a possibility that it would, get worse. All right. So the vaccinated and the unvaccinated. So based on what you know now, your statistics, tell us about what's happening with the vaccinated, unvaccinated spread and which populations are most affected.
Okay. So right now in South Carolina, 42% of the people are fully vaccinated. 42% in South Carolina, as opposed to 52% in the United States. Okay. In South Carolina, 54% of the people have gotten at least one dose of the vaccine. In the United States, 61% of people have gotten at least one vaccine.
So Doc, what kind of impact is it having on our children now that they're becoming to focus?
So what happened last Friday was the first time South Carolina went over 5,000 cases in a day.
Last Friday. Okay.
Last Friday. It was over 5,200 to be exact. First time since January of this year that it went over 5,000. Okay. And 47% of those people were under 30. Okay, so out of the 5,200, 47 were under 30 years old. 12% were under 10 years old. Now, I'm going to give you a comparative to that. So on Friday, 12% were under 10. Back in March and April of 2020, only 1.6% were under 10.
Wow.
And at the height of the pandemic, back in December through February, December 20 or February 21, only 5.8% were under 10 years old. So right now, about 12% of people are under 10. 17% are between 10 and 17. As opposed to March and April of 2020, it was only 5.5.
And could we ask why is that?
Well, partly because of the vaccination. I mean, you got 12 and up that are eligible for the vaccine, but you still got a number of people that are in vaccination age that are not getting vaccinated.
Mm-hmm. Mm-hmm.
And so as more, it's the unvaccinated people that's passing this COVID-19.
Mm.
Well, we say the Delta variant, but I don't want you to really say Delta because there's going to be a Lambda, there's going to be a Gamma, there's going to be a Theta, there's going to be more. It's just COVID-19.
Okay.
Because right now the predominant strain is Delta. There's still the Alpha out. There's still the other strains out. It's just that the predominant strain is Delta.
Is it likely
and what they do when they?
I was going to ask, is it likely that these strains will become stronger and stronger?
That's the thought. That's what we're worried about. It appears that that's what's happening right now.
It's mutating.
And so what happens is that as each strain comes by, the thought is that it will get stronger and stronger. In medicine, we will never say that though until we know that to be a fact, until we see the R0 of it. In other words, I'm infected. How many people am I likely to infect? Again, the initial strain had R0 of 2, which means if I was positive, I would be expected to infect 2 people. Right now, the R0 for Delta is 8. So every one person that's positive will likely infect 8 other people.
What's the likelihood, and of course, we've already heard of some cases in South Carolina. I don't know how many in Horry County, but what's the likelihood that this, well, based on what you said, this population under 10 is going to grow? And now that we're back in school and mask wearing appears to be more of a choice than a mandate, what's the likelihood that, you know, the number will spike quickly since school has started? But also, what can parents expect in terms of what the children may experience? Would they be the same types of symptoms and ailments that the adults have, or do you all have enough information to, I guess,
It'll likely be the same symptoms, but there are some other conditions that are more inherent in kids, like something called RSV, respiratory syncytial virus,
yes. Mm-hmm.
that has been seeing spikes of that in times where we really didn't expect to see RSV.
Mm-hmm. Mm-hmm.
So RSV typically is more of a winter type thing. We're seeing it more so with RSV-like symptoms in these kids. And you're having children's hospitals across the United States that don't have beds.
Mm-hmm.
That don't have beds. I was in Houston last month, and in the city of Houston, there wasn't a pediatric bed in the whole city.
Mm.
And that's amazing, because Houston has the largest medical complex or complex system of medicine centers in the United States.
Mm. Yeah,
so it's a problem. And you know, again, I think the last I read, there were 8 states that dropped the school mask mandate, and all 8 states had Republican governors. Now, I don't want to get too much into politics of this thing, because my blood pressure will start to go up. But you've got people who probably barely passed high school science that's making these decisions on what to do. I've been doing this for close to 30 years now. I've trained at the CDC. I've trained in viruses. I've trained in public health. I've trained in biostatistics, and I trained in epidemiology. And I saw this coming months ago. I saw this coming a year ago. We talked about this a while ago, April.
Mm-hmm. Mm-hmm. We did. Mm-hmm.
And the problem that most physicians and healthcare workers are having is a lot of healthcare workers and physicians are starting to get burnt out about COVID. You're having nurses that are leaving the healthcare system because they're burnt out. I mean, you know, when you've got people saying this isn't real, it's a hoax, you know, everybody is going to get touched by COVID.
Mm-hmm.
That's it. That's going to be my prediction. Everybody will get COVID. And the people that won't likely get is if they had the vaccine. However, we're seeing breakthrough cases with that. Hence, the talk about the boosters. But this is a virus that pretty much everybody's going to get touched by. Mm-hmm. The hope is that the symptoms are mild. The hope is that, you know, people can get through this, but we're seeing people that are dying. I had 2 high school classmates a couple weeks ago that died.
Mm-hmm.
We had a couple people from right around here in Conway who lived in other states that died. And so the point I'm at, I almost died.
Right.
So,
right.
You know,
Yeah.
Right.
You know, whenever I hear people talking like that, I try to answer questions when I can, but most people who haven't gotten the vaccine now, unfortunately, the large percentage of those people are probably not going to get vaccinated.
Mm-hmm.
Because the proof is in the pudding. I'm still talking, still telling people to get the vaccine, but I'm telling you, this is no hoax. This is for real. People are dying. People are getting sick. And I want people to understand the severity of this. South Carolina's had over 10,000 deaths so far. 10,000. And again, it's I read a story over the weekend where there was a person that showed up in an emergency room, I think in Missouri, and the person had a mass in their intestines, likely cancer. They had to ship that person all the way to Pennsylvania to get surgery. The problem is hospitals now are overrun. They're not doing elective surgeries or procedures right now, most of the hospitals, because they have no beds. ER waits right now anywhere between 5 to 12 hours. So I'm saying this as adamantly as I can. It's no different from what we've been saying all in 2020 on our show, April. This will get worse if you don't protect yourself.
I think a part of the problem too is that people have this idea that, in the vaccinated community, people have this idea that because they are vaccinated, they cannot get COVID. And no one ever said that you will not get COVID if you get vaccinated. And so when you talk I can't trace that anywhere. When you talk to people there, I'm good, I'm vaccinated. So they don't want to wear a mask and they will not social distance or use social distancing. And the truth of the matter is that, yes, you definitely can get COVID if you're vaccinated. And take a look at, if I'm not mistaken, Reverend Jesse Jackson and his wife, both vaccinated and now hospitalized with COVID. There are other people that I know who vaccinated and they now have COVID. So, just like Bonnie Edie said, too much false information going around. Yeah, I think people need to definitely be particular about the information they're taking in and willing to even, disseminate or spread because they're adding to that falsehood that it can't happen. And also, when it comes down to the unvaccinated, I know it's a choice. I understand all of that. I saw today that Pfizer is now officially FDA approved. And so if it's about not being sure of the vaccinations, you now have one that is FDA approved. Most supplements you take on a daily basis aren't FDA approved. So I think that people just need to really take a step back and do their own research and then rely on more reputable sources for information versus friends and family and other people who just have these theories and concepts in their minds about why it's bad to take the vaccine, and no, there aren't any chip bits in the vaccines. Okay, if you're worried about a chip bit, worry about your cell phone.
Let me say a couple things about the FDA approval. Okay, the FDA, when these vaccines first came out, they asked for EAU, emergency use authorization. The reason why they went through the emergency use authorization, most physicians believe, is so that it could be tracked how many people got the vaccine. Okay, once the vaccine becomes fully disseminated, then it's not going to be quite as easy to know how many people got the vaccine. But when it's under an emergency use authorization, there are only certain places that can get the vaccine. Hospitals, governmental agencies, and pharmacies in this case. So it's an easier way to track how many vaccines went out compared to how many people got it. So it's not that there's anything bad about the vaccine that it wasn't approved. It's just under an EAU, it's more tightly controlled as to who gets the vaccines. In other words, when it was under EAU, I couldn't order the vaccine. It was only given to certain specific places, or my office couldn't. And that's part of the reason, the main reason why it was done that way. The thought from the CDC and the government was that maybe part of this vaccine hesitancy was because it was being said it's not authorized. And so by doing that, hopefully more people will get it out of their mind that there's nothing bad about the vaccine.
Mm-hmm. So you've given us a lot of information about the clinical side of COVID-19 as it relates to this Delta variant. And so let's quickly just kind of share with people some of the protocols that they need to follow moving forward.
Okay, let me say this too. Right now, whenever in medicine and biostatistics, we look at how much infection is in a community, we look at what's called the positivity rate. Okay, that means how many people are positive in comparison to how many tests were done in that area. For an area to be considered a low level of infection in that area, you'd want a positivity rate of less than 5%. Right now, South Carolina is right at 15%. Let me repeat that one more time, because that's 3 times what it should be. The positivity rate should be less than 5% for any given said infectious agent. Ours is 14.8% in South Carolina. That's astounding. That's worrisome. Because that means South Carolina has got some problems. Now, of course, there's some other states where the positivity rate is higher. Louisiana got some problems. Florida definitely has some problems. Texas has got some problems. But South Carolina has a very high positivity rate in a state that does not have a school mask mandate. So when you put all these factors together,
absolutely,
you're creating a perfect storm. I was so glad that the state Supreme Court went back and said that these colleges have the authority to have mask mandates on their campuses, because that age group, that invincible age group of 15 to 25, there's a problem there. There's a major problem there.
Dr. Mack, and I don't remember what it was last year when everything finally shut down, but what's the magic number for possible quarantines and shutdowns to happen, which I know they're, mandated and governed by certain people, but as we look at infection or infectious rates, what would be the magic number?
We're there now.
We're there
now. There's no reason why there's not a school mask mandate. There's 8 states in the United States that dropped their school mask mandate. All 8 of them have Republican governors.
And can I say that some of those states, the people are going against the governor and doing it anyway?
Well, some of the municipalities in those states are doing it, but still, again, and that's good. That's great. And as it should be. But again, any inclination that a governor is going to say that a state doesn't have to do it, just going to lead to more chaos.
Yes.
And more death and more disease. And it's no surprise Florida is leading the United States. It's no surprise. None.
Well, Dr. Mack, thank you so much for all of this information. I know it's supposed to be a medical minute, but this was some serious stuff that we needed to go over. And Marvin asked about the quarantines and lockdowns. Should they be in effect? Do you think they should be in effect?
Well, that's a good question, Marvin. I definitely think first starting off, there should be mask mandates in schools. I get it. These kids need to be in school. I get it. I get it. But I think there are safeguards that can be in place to help try to make it as safe as they possibly can. I do think that, I don't know, somehow, somewhere, somebody got the word that the pandemic was over. I never got that memo, but somebody somewhere, because we're having all kind of festivals and having all kind of people showing up, and country music festival and this and that, and I'm like, well, when did the pandemic get over? Who dropped the gavel on the pandemic and saying here, we're done? I didn't get that. I've had over 350 patients with COVID. I had 10 people today that called me, and in the last 72 hours were diagnosed with COVID.
Mm-hmm.
It's getting worse.
Mm-hmm.
It's getting worse.
Mm-hmm.
So,
Well, go ahead, brother.
So, Doc, what I know probably hasn't been any studies done on that, but the practicing prevention, like the distancing, and of course we're dealing with the mask already, but is there some way that could be not? I don't want to use the word mandated, but is there somewhere that you can kind of like push that? Not you, but the authorities. Have you been in any kind of forums dealing with that, and as the reason why they don't push that and they won't make it a mandate?
Won't make what a mandate?
The distancing and the mask themselves.
The social distancing.
Right.
Well, again, there's some people that just. Well, I think it's twofold. I think number one, I think a lot of folks have gotten the vaccine. Some of these politicians that have not, they're not saying that they got the vaccine, but they got it. And some people's mentality is like, well, if you don't get the vaccine and you get sick and die, oh, well, you had your chance to get it. There's a large consensus about that. If some of the politicians believe that, they got to get and acknowledge this more, then they got to go and they got to talk about schools more. They got to talk about work more. They got to talk about business more. And it becomes a financial thing. So there's different layers to the whole thing, financially, economically, politically. I don't know. I mean, I don't know. It just frustrates physicians when you have non-physicians making calls on things that I'm not sure if that politician passed high school science.
No, that's a good point.
And so, if you can't tell me the difference between a virus or a bacteria, it's not much you can tell me about COVID.
Well, again, Doc, thank you so much for the information. And I know we could go on and on with our diatribe about, what we know and what they don't know. I think the main thing that we really wanted to achieve today was to make sure that everyone heard from someone who obviously has done the work, has been in the medical field for a number of decades, understands the virus, has the credentials to speak on it. And we appreciate the work that you're doing, and we're grateful that you're still here with us and you have a COVID survival story. So thank you again. And if the need arises, and I'm sure it will, we may call on you again to give us some more information about the variant. But we really want people to understand a few things, and I don't think it's changed from when you and I had the show last year with the COVID updates. But mask up, wear your mask up, social distancing. I know of some, I'll put it this way, a municipality in a different state that has actually decided that a group of 6 is too many. So, they are not in favor of large group gatherings and meet in, especially having lunches and dinners in a room where there's a lot of people, because you're eating and there's the possibility of spread from the spittle and things like that, droplets that hit the air. They're, watching things closely. And the bottom line is, if you want to have these events, if you want to move forward with any type of gatherings, you have to understand what the consequences could be if you don't practice safe measures. And so thank you. And, of course, I think we're advocates for vaccination. Yes, it is a choice. I actually got into it. I'll call it a healthy debate today with someone on social media about that. And my comment to this particular person, Larry, you're going to love this. My comment to this particular person was, yeah, it is a choice. The person made a comment that they're pro-choice. And I said, well, I'm pro-choice too. But I think if I had the choice to go into a gas chamber with a mask or not, I'm going to choose a mask. So, the bottom line is we're in an environment right now where we're dealing with a deadly virus. And so, the choice is yours. But thank you again, Doc. Please stick around. Yeah, go ahead.
Before I leave, I want to say this real quick. I had a conversation with a patient today, and it reminded me, and I told them this, they didn't hear it before, but it reminded me of the parable of the drowning man. You ever heard of that before? The parable of the drowning man?
Tell us about it.
So, real in a nutshell, there was a man that was stuck on his rooftop in a flood. He was praying to God for help. He kept praying, and soon he saw a rowboat come by. The man driving the rowboat said, come on in, jump on in, I can save you, I can take care of you, we can get you from drowning. The man says, no, I'm okay, I'm praying to God, and he's going to save me, he's going to take care of me. So the man in the rowboat went on by. Man kept praying. Next thing you know, a motorboat came by. Man in the motorboat said, come on in. I can save you. The water's rising. It's getting even higher than it was when the rowboat came by. Come on in. The man says, no, I'm okay. I don't need to go because I'm praying to God and God's going to take care of me and I'm okay. So the motorboat went by. A helicopter came by. This time the water was way up. I mean, it was way up. The man said, no, I don't need this helicopter because I'm still praying to God. God's going to save me. I'm going to be all right. I don't need this helicopter. The guy in the helicopter said, you better get in here because soon you're going to drown. The man said, no, thank you, but God's going to save me. What happens? The man drowns. He gets to heaven. He said, God, I was praying to you. Why didn't you save me? And God said, come on, man. I gave you a rowboat, a motorboat, and a helicopter. In other words, you got to make your decisions sound decisions. In other words, you have to look at what's in front of you. God is giving you positions. He's epidemiologists. He's giving you biostatistics. He's giving you researchers. He's giving you people to save your lives. And guess what? The choice is up to you. So that's the parable of the drowning man. God said, what more do you want me to do? I sent you everybody I could send you to save you. I gave you a boat, a motorboat, a rowboat, and a helicopter. So anyway,
it didn't come the way he wanted it.
You're right.
That's usually the problem right there. Mm-hmm.
That's right.
The problem. Thank you, Dr. Matt. We really do appreciate it. Please stick around. Because we get ready to talk to Councilman Larry White.
It's a good parable, Doc.
It is a good parable. Yes.
So sometimes we are our worst enemies because we don't listen. We know everything. I got all the answers, but we don't. Somebody else is out there smarter than you.
Exactly.
So good evening, ladies and gentlemen. How you doing?
How are you doing is the question.
I'm good. I was told about there was an article going around that I voted no for against the mask mandate, and I did. There was a reason to my madness, though. At first, let's get the backstory. We had not said anything to the general public about the virus coming back and these types of things. And so I sent a message. I said, look, we need to make a statement of some sort to the public so that they know that we are at least concerned about our citizens. So we had the meeting, and at the meeting, it came up to have not a mandate, but to encourage wearing masks. Eventually, we got to the vote, and there was a vote that we said we were going to the mayor made the motion, I think it was first, that we have encourage all the citizens to wear masks inside of all of the city businesses, buildings, etc. It died. It was 3-3 vote. the count was, and so that it didn't pass for lack of a majority. So the next motion came up to be that we will have masks in all of the city buildings except the recreation facility. And I voted no against it because of that fact. We accepted, kicked out the recreation center. That's where most of the kids are. In the city buildings, if you would, is at the recreation facility. So I voted against it. Not that I did not want the masks. No, I did not. I wanted everybody to be masked up in the city buildings. Because if they went to the rec and then came to City Hall, they could have given it to somebody there, or vice versa. So I wanted to make the point that all of our city buildings should have the same. Same thing. When your parents would tell you, if you give one something, you got to give all. Same thing. That's where I was coming from with that. And it wasn't as if I did not want the mask. No, I wanted everybody to have the same equality in all of the city buildings. So to those of you who thought I just voted no against the mask, that wasn't it. I voted against the process that we were doing at the time. So I thank you for listening to that a little bit. But, sometimes you have to stand up for what you believe in. You should stand up for what you believe in at any cost. But then we just have to make sure that we're doing the right thing. We have a lot of power in our hands as city representatives. And I want to make sure that we do the right thing for all of our citizens, not just for some select few. So I'm hoping that eventually we'll get back to that issue again, and so that we can include the rec center. But for the time being, that's how the majority voted to have just all of the buildings wearing masks once you come in, with the exception of the city hall. The recreation facility. So I'm hoping that we can do something to make that change. But we'll wait and see what's going to happen at our next meeting. Comments.
Well, Larry, so if the vote, if they're saying, okay, there's no requirement in terms of indoor wearing a mask indoors at the rec center, what other measures are they taking to make sure that that facility remains safe for those who are using it? Are there some social distancing guidelines? Are they sanitizing it regularly? What are they doing?
Well, I have not been there for that same reason. I did not want to go in there. I should have, and I beg to differ. I did not, but we need to go there just to see what they are doing. Last time, during the last virus time, there was as you walked in the door, they took your temperature. Okay, and I'm hoping that Ashley, if you're out there listening, I'm hoping that you are doing that at least that much when you're coming in. But then I want to go to the Olympics. They were saying that the kids cannot wear masks and play basketball. They can't wear masks and go swimming. If you watch the Olympics, each one of those sports people that came up, they had the mask on. When they did their sport participation, if you would, then they took the mask off. After the event was over, they put it back on. Even the swimmers did the same thing. So we can do this, but we got to make up our mind to do it. As far as we letting the kids just come in and they're playing ball all day long, they can play ball, but when they're not playing ball, put the mask on. Every little bit helps. That's my point. Doc, I saw you want to say something. Yeah. Dr. May.
I've got a question.
Mm-hmm.
Why was the recreation department left off? Did you say that and I missed it?
You could have, but
I'm a why type person, so I guess the question is, why was that place excluded and the other places were included?
I would think it had to be with individuals on the council feeling that place did not need to be masked because it was a sports place. That's that doesn't mean a hill of bean to me. That's where most of the kids are in all of our city buildings.
I wonder what physician was contacted to ask their opinion about that.
None. And I was trying to hold up that meeting for that reason, not for your reason, getting you there, but I wanted Ashley to come in and say something about what he thought about the decision about not masking or not. And he came in and he kind of more or less went along with the idea that they didn't necessarily need masks there. Because most of the sports, the fall sports were coming. I think that was his, answer. Fall sports are coming, and it's going to be outside. Outside is a whole different ball game from inside, to me. I never ran a recreation facility, anything of that nature, but I played ball. And then I watched TV the other day, and they had some football players, high school football players, with masks on while they were outside doing their, their routines, etc. So it can be done, just that we don't want it to happen, and it did not happen. It ain't over, though.
Doc's looking real perplexed right now. So, okay. So will the city revisit this plan later, or what? Especially with the numbers rising.
Yeah, I'm going to bring it up again, whether they vote on it or not. I will bring that up as a personal issue of concern, because that's a concern to me. And hopefully the guys that voted against this piece, that voted in favor of not having the rate, I'm hoping that they would have a come to Jesus thought, a prayer or something, so that they can be change their minds about it. We did it before when we first had the mask mandate in the city. It was 4 against 2. 4 against 3, and then they went home, and I guess they somebody beat them up or something. But then a couple of days later, no, we want to change our minds. So I'm hoping they're going to change their minds again, because I just believe in that hope that they're going to do the right thing. Because the kids, that's what we're opening the rate for, mostly for them. We got adults that have to pay for it as well, but the adults have a choice. Some of the kids that come to the rate do not have a choice, especially if they're under 10 or 12. I think that's the number now, 12 and under, can't get the vaccine. So we don't know where they are going and coming in the rate and bringing it with them. So I'm hoping we will put some more protocols in place, if you would, to make sure that they're being the temperatures being taken when they come in, and also allow them to wear masks when they're not playing, because the staff have to wear masks.
Right. Dr. Matt, could this be rooted in the, I guess, the thought or the mindset from, COVID-19 days, well, the first round of COVID-19, that children or the young folks were kind of, I guess, immune or could not spread COVID, or they couldn't catch COVID?
Right. And that's the reason why I asked what physician was contacted, because I just gave you the numbers to show that it's rising faster in people 10 to 25. Those are the people that spread it. So if you get a bunch of people together that have that start spreading COVID, and then they take it home to mama, daddy, grandmama, and granddaddy, who may have been vaccinated fully, but they have a compromised immune system, they can be part of the breakthrough COVID cases. Mm-hmm. So, right now the CDC guidelines is indoors, people should be wearing masks.
Mm-hmm. Mm-hmm. Yeah. Mm-hmm. And see, this wasn't, I'm quite sure other people thought about it on me, but I'm one of those that want to say something about it. If nobody says, I got to say something. Y'all need to, we need to do something about this. Say something so that the folks know at least we're paying attention to what's going on in our community. So I'm hoping now that the numbers are not just because the numbers are going up, that we will have another conversation about this, and hopefully change the mask situation at the rec center.
There's a question. Do you know if there are any COVID cases in the rec building?
Not that I know of. We haven't been given any note that any of the staff or anybody that at the rec center has COVID. No.
Mm-hmm. Okay. All right. So as far as City of Conway and businesses, what kind of protocols are in place right now?
None. I think they can do what they want. Yeah, because we did not do the mandate of businesses, etc. They can do whatever they want in their private places. If they want to wear masks, they can. If they don't, that's on the business owners. At present.
Okay. All right. Well,
April, I'm kind of hesitant about bringing this on, but I've got this comment from a young lady that she texted in lieu of a phone call. I tried to get her to talk on the phone, but she went on to say that the reason that she thought, this is her opinion, that the council voted the way they voted was because they wanted their children to get out of the house or something like that, or get out of the.
See, I don't have children. So
I do want to, convey people's, their comments, their thoughts. Okay, she didn't have the necessary tech to put the comments on the side of the screen there, and nor did she want to talk on the phone. So I thought
I would say this to the answer to that. If the councilmen and women, just councilmen that have children there, when their children get sick, then they'll probably, well, I wish we had done that. I'm hoping it doesn't come to that, but I pray that doesn't happen. And it could be the reason for why they get out of the house, because they've had, not just the council people now, the general public, everybody has had their kids at home for a long time. And parents, they're tired of being around the kids. The kids probably tired of being around moms and dads, and that's an outlet for them. So if we have all these protocols at the rec center that parents might not believe in, then the kids are not going to do it. But whenever we were growing up, if mom and daddy told us to do something and we didn't do it, you know what happened to us. Sometimes people are saying that I can't tell my child, I'll make my child wear a mask. Why not? Who's the parent? You're the parent. You tell them what to do. You make them do it, or cut their butt. Not put them in timeout. Because that don't work for some kids. Oh, girl, no, I didn't get it.
No, we didn't go for the timeout.
No, we didn't do the timeout thing.
So city council.
Yes, so I'm just praying that we will come back to this issue again, and I'm hoping that the numbers at the rec specifically do not have any problems with the virus there, so that we won't have to say, "Well, I told you so," and that's not me, but somebody will say that.
So Larry, who's responsible for watching the I guess the progress with the variant, and who's keeping up with statistics?
Yeah.
Is it the city manager, county manager? Who's doing that?
City manager. The city manager does.
And does the city manager make a lot of the calls as far as what the city should do in terms of the protocol, or is that information handed down to city council and then you all make decisions? How does it work?
We kind of vote on that. He might come with recommendations. Mm-hmm. Yeah, he might come with recommendations that I recommend this, and this, and they discuss it. And if we agree, then we take the vote.
Mm-hmm. Okay.
Yeah.
All right.
Oh, all right. There was a question as to why the names of the variants are Greek letters.
Yeah.
Typically, it's done in reference to most things in medicine being Latin and Greek, which are really of Egyptian origin. And a lot of times, too, the names started becoming kind of cumbersome. Like, for example, the South African variant had multiple names. B1-351. Another one was 501Y.2. The other one was 20H/501YV2. So instead of the names becoming more cumbersome, they just decided to simplify it. And as a lot of things have basis out of Greek and Latin origins, which really come from Egyptian origins, really.
Okay. Well, let's take a quick break before we wrap up the show. And
April, I'm sorry. I got a phone call that someone wants to ask a question. Is that okay?
Yeah, go ahead. Pipe them in.
Okay. All right. Let's see. I think we have Miss D. Witt on the phone. You go ahead and ask your questions, Edna.
Good evening to you. Good evening evening to the panel. Very good discussion, very good information, very much needed to the community. But I would love for Dr. McIver to, again, give the names of the variants that may be coming forward.
What? Give the name of what now?
Brother Edward, can you mute that?
The names of the variants that are coming forth.
Well, right now, I mean, you've got the original strains, you've got Delta that's out, and you've got Lambda. So what happens when they get these samples to test to see if it is COVID? What they're doing is they're looking at the makeup of the virus, and if they see any difference in the viruses, such as the spike proteins, the general structure of the molecule, that's when it gets a separate Greek letter designation.
So does that answer your question?
I saw a question also of what was the spike protein?
Yeah, spike protein is a protein that's on the molecule, on the virus. So in other words, this group of viruses are called coronaviruses, corona being a crown. The virus under electron microscope looks like it has a crown on it. It has a different configuration that makes it unique, for that kind of virus. And so if other viruses have that same structural makeup on the outer core, it'll be a part of the coronavirus. COVID-19 is a type of coronavirus. Delta is a variation of COVID-19.
Ron Conwell beat
Yeah,
you.
I had to put that comment. Because I know he said that for a number
much earlier.
Hey,
said
you
that for a
gotta
number of
get to Kappa
reasons.
before you get to Omega.
It had to be the Q dog.
Had to be the Omega. I tell you. Leave it to Link.
That's my big. Link is my big brother.
Yeah. That was funny. We needed a bit of humor after all of this heavy information.
Yeah, absolutely.
Really, really good information. Great questions. Miss McIver says too cute. Absolutely. So we're going to go to a quick commercial break. Brother Edward, if you get any more calls, tell them to stand by. And then we'll come back. Please hold on for just a second. We have a couple of community announcements and a couple of commercials. So we'll be right back in just a moment. All right, Brother Edward, we are back, and I've got a couple of
Mosquitoes at that.
yeah. I thought we were just about done with this. Maybe this is the last spray for the season. I don't know. But anyway, mosquito spraying is happening the 25th and the 26th. So just be mindful of that. Area spraying will begin 30 minutes prior to sunset and 30 minutes after sunset, weather permitting. Also, want to let you all know that there's a open house for adult education, which is, that's great. It's time for you to, get serious about education on August the 25th from 11 to 1 and the 31st from 11 to 1 in Myrtle Beach. Horry County Adult Ed will have an open house, learn more about numerous free programs and services, observe classes, family literacy programs, discover career pathways, free Windows and GED WIN and GED practice tests, and so much more. So get in touch with Horry County Adult Ed for more information about that. Also, there's a redistricting symposium coming up on Monday, August the 30th at 6:30 p.m. Moderator is Reverend Dorothy K. Reeves. And of course, the special guest will be the Honorable Orton Bellamy, County Council District 7, the Honorable Barbara Blaine Bellamy, who is the mayor of Conway, and Marion D. Foxworth is the guest speaker. This event is happening at Bethlehem No. 1 Missionary Baptist Church at 1503 Dirty Branch Road in Conway. Pastor Sonny Bridges is the officiant. And so if you have any questions, Brother Edward, it doesn't say who to get in touch with if there are any questions about it, but we'll make sure that these flyers are posted so that you can get this information later on.
Absolutely.
Okay. Also, there's the Grand Strand Community Expo that's coming up in September. So believe it or not, we're pretty much wrapping up August. This is the last full week of August. It's time to start setting your September calendars. This is going to be Saturday, September 18th at Freewood Farms from 4 to 8 p.m. Grand Strand Community Expo, and this is sponsored by South Carolina and Horry County Democratic Women's Councils. For more information, you can certainly reach out to any of these organizations to understand what's going on. Healthcare, fire truck, police car, voter registration, you name it, they're going to have it out there for the community. And then also there's going to be a police cookout September the 18th from 11 to 3 up in North Myrtle Beach at the sports complex. Come out and visit with the officers, the K-9s, firefighters, and just get to know your law enforcement officials. So we definitely want to share that information, Brother Edward, with the community. And then also I wanted to make mention that our summer literacy program wrapped up in a very successful way. Of course, we featured the youth on WCM Live, and recently they were awarded their incentives for participating. And a lot of, most of them, or a good bit of them, received incentives of up to $150 for their participation. And they also received a certificate and back to school supplies. So we encourage participation for next year. And we certainly enjoyed working with the students again this summer. We read Stella by Starlight. It was a wonderful book. We had a great discussion. And so now that you know that there is a growing summer literacy program that is sponsored by some wonderful people in the community who just want to make sure our kids are reading for the summer. Make sure you put it on your calendars, or at least on your radars, to sign your youth up ages. Well, I'll say ages 8 and up, 8 to 17. 8 to 17, because that's the range that we pretty much had for the past 2 summers. Let's see if there are any more comments before we go.
I got asked a question, April.
Yes.
And I guess it was in reference to the seasons and COVID. Mm-hmm. We do expect an increase in COVID cases during the colder months, primarily because more people are inside. It's cold and flu type weather. Mm-hmm. I just wanted to make sure that I said that accurately.
Mm-hmm. Okay.
Although it's not like summer months will kill the virus, is what I was trying to say earlier. So to clarify that point. Okay. People are doing more indoor activities during colder months, and that kind of thing.
Well, if the hot weather doesn't get you, the COVID will. was it? If not, it's been hot.
Brother Edward.
Oh man,
You know what?
it's been bad.
He's gonna burn. He's gonna burn.
Doc, you got look. You guys have conveyed some very, very important information, and I certainly hope that our viewers took advantage of, and to help. Now that they're informed, they can make informed decisions about a lot of things. And I certainly appreciate the both of you. I knew this was going to be heavy. When
one more thing
right.
before you go.
Yeah, go ahead.
I want to also encourage all of us to come to city council meeting sometime. Don't wait until it's something that's just your issue to come. You need to come frequently so people can see that you have concerns about your community in which you live in. And there's election coming up pretty soon for 3 council seats, I'll say it that way, and try to find out who these people are that's going to be running for the city council, and choose the right ones of your choice. I'm not telling you who to vote for, but just make sure you do exercise the right to vote and come to city council meetings as often as you can. And good. The next is the 7th.
Councilman White, we're working on that. We're going to get somebody to represent the community. We're trying to get someone to represent the community at each meeting. Okay, right. And come back with some information that will really help us make more informed decisions. Okay, because there are a lot of
I'm going to also make a suggestion that information that we have at City Council be funneled to you and PJ Parish so that the community can hear some of this also, because everybody in our community do not watch the television, the City Access channel. Mm-hmm. So that's where a lot of information is about what's going on in the city. But everybody does not watch that. So I'm going to ask that they send it to you and also to PJ Parish at the radio station so that he also and you can get this information out as well. Mm-hmm. Whether it's going to get done or not, I don't know. But I'm putting them on the spot.
we're getting there. It's going to be a good dissemination. It's going to be efficient. Right. We'll get there.
That's good.
All right. Well, we have had interestingly enough, a good time, even though we talked about a very heavy subject. And I think that, we needed to start off with what was most important, that priority of getting that information out there. And please know that, we basically co-sign whatever Dr. Mack says. We believe in him as our one of the physicians in our community. And, definitely I would not have been sidecar with him for 9 months through the COVID pandemic when we originally were struck with it, if I didn't believe in his science and his work. And so, Dr. Mack, thank you so much for being here tonight. And again, we may lean on you a little bit later for some more information. So hopefully you'll be on standby.
You welcome. The car is just in the shop. It's not in the junk pile.
I got you.
It'll get back on the road.
Gotcha.
It'll get back on the road.
All right. That sounds good to me. Okay. And Councilman Larry White, you keep doing what you're doing. Fight the good fight. Fight the good fight. I said to you, Larry, I'm getting a lot of questions, and I told some people, I said, hey, just let me go straight to the horse. I'm going to go straight to the horse and find out what the deal is.
I don't mind telling you. That's right. And I'll get it right sooner or later. Thank you very much for having me on here as well. And I'm hoping that everybody will get vaccinated and wear your mask and social distance.
Yep. Absolutely. 100%. Brother Edward, you have the last word.
I've said it. Sorry. I've said it. Keep those masks going. Just keep those masks going. Okay. Sorry, we're not able to get involved with that mandate. If we had some a little bit of influence there, maybe it could have turned out differently. But it's not it.
It ain't over. It ain't over.
I'd like to say that. Yeah. So to our viewers and you, April, thank you so much. We see everybody next week. God bless. Same time, 7 p.m. On the 3 options that is usually presented to you in the promo. YouTube, as it's our website, WCMagazine.net, and Facebook, of course.
All right. Well, everyone go ahead, man.
One more thing, Brother Edward, I can't really ever talk to you without saying hello to Miss McQueen. So you please give her my regards, okay?
I'll certainly do that, sir.
I mean, we like you, Brother Edward, but we love her, okay?
I think you told me that. Look, you told me that ever since you put me on probation at the Million Man. I mean the 100 Black Men.
I mean, we like you a lot, Brother Edward, but we love Sister McQueen.
She had a question, by the way, and they were all kind of rolling in quickly, and I'm glad that triggered my thought. She said, great information, Doc. Should we get a home kit to know more about the symptoms prior to coming to your office?
A home testing kit, you mean?
Yeah, right.
Well, you know, there's some question about the what we call the sensitivity and the specificity of those. In other words, if it says you're positive, then you're likely positive. If it says you're negative, you can still be positive. So we call that sensitivity and specificity in science, in our statistics. So, you know, it's better than nothing, but just because it's negative does not mean you don't necessarily have it.
Okay.
If it says positive though, then you're more than likely positive.
Okay.
That's the specificity. But the sensitivity is that it could still be positive and have a negative test. So if you mix that rapid test with a person that's having symptoms, then that's a little bit more information. But still, if it's negative, you could still have COVID.
All right. Okay. Yeah.
Mind blowing.
Yeah, really is.
All right. Well, again,
just go to the doctor. Just go to the doctor.
I think that's what he's trying to say.
Yeah.
Go straight to the horse. To the horse.
Go to a COVID testing site. Go to DHEC or somewhere else, and because there might be some user error in there too. Because if they're sticking anything up their noses, they're probably having a hard time doing it, Larry. So,
or if you're positive and you around your wife 24/7, stay your butt at home and isolate.
Right.
Right. Yeah.
Particularly if you got symptoms.
Exactly.
Unless you're doing bad and you need to go get attention. But if the symptoms are kind of mild, you can stay at home and isolate, quarantine.
I tell you, we're never void of information, and so again, thank you, Doc.
Hey, you're only going to get it on WC Live.
Hey,
is that correct?
Hey, that's right.
Everybody's in agreement with that.
That's right.
I agree.
So,
Thank you.
You're gonna get the real deal here, right, Larry?
Real deal. All right.
He said power to the people. All right, we're going on that note. Thanks everybody for joining us tonight.
Thank you.
Stay safe.
Right.
Yes. Stay safe and God bless. Yeah.
See you next week.
See you next week.
Bye-bye.
Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your host Edward McQueen and April Garner.